Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. In this segment, we're going to have a conversation with Dr. David Fairchild. He's joining us here from CVS MinuteClinic to talk about the many ways that virtual care has evolved since the pandemic's virtual care boom, based on some new data from CVS Healthcare's Insight study. Welcome to Health Professional Radio, Dr. Fairchild. Thank you so much for joining us.
Yeah, thank you, Neil. It's a pleasure to be here.
Well, tell us a bit about yourself above and beyond CVS and explain your role at CVS.
Yes, thank you. I'm a general internist by training. I've been a practicing primary care doctor for over 30 years. And in 2019, I joined CVS Health as the Chief Medical Officer for the MinuteClinics and the Senior Vice President at CVS Health, where I'm also the Associate Chief Medical Officer for the Healthcare Enterprise. And I'm a fellow of the American College of Physicians.
As I said, we were going to talk a bit about post-pandemic virtual care. What does the post-pandemic virtual care field look like currently?
Yeah, it's really interesting, Neil. As a practicing physician for 30 years, as I mentioned, we've been talking about patient-centric care for quite a while. And it's interesting. I think the pandemic actually taught us what that really means. And what I mean by that is that the pandemic has forced us in healthcare delivery to really evolve quickly. We went from, as health services to really not offering very much in the virtual space to overnight figuring out how to do that. Mm-hmm. So both providers and patients during the pandemic learned that virtual care actually worked. Patients appreciated the convenience, and doctors were grateful to be able to have a way to contact their patients. And so that was a real game changer, and I think is going to have permanently changed the way in which we offer services. So in our Healthcare Insight study, 59% of consumers, for example, felt it was important that to their health that they had access to virtual and telehealth services. So that's an amazing statistic. And so obviously, clearly, the pandemic has sort of opened everyone's eyes to the importance of virtual. On the provider side, over half of the providers in the survey offered virtual visits, indicate that this option has actually increased their overall patient visits. So I think it's also seen by providers as a way to connect with their patients that they didn't have before. And as I say, I think this is going to be an inflection point, and the survey bears this out, that going forward, providers and patients are going to be expecting that virtual is part of this offering. It's no longer acceptable just to say, well, you have to come in and see me as a provider every single time. And so I think that's going to shape the post-pandemic environment.
The pandemic not only showed us how to quickly transform, but it also revealed that many of the things that we had been doing for generations just weren't necessary.
Well, that's such a good point. Like you say, there's been a sort of strong tradition, call it, in healthcare services that I would express, and as a doctor, saying was fairly provider-centric. That, in other words, the providers set up the system to be what they needed. And, let's face it, Neil, the healthcare system is complicated, right? It's a combination of what patients want and what providers want, but what insurance companies require of you, what the technology allows. So there are lots of reasons why the healthcare system has evolved to the way it is, including our reimbursement system that, has always prioritized and actually forced, in some ways, patients to come in and see their doctor. So, and to your point, that's not always been necessary. And now it's, like you say, the pandemic has basically shown us, hey, 85, I'm making this number up, but, a good percentage of healthcare things can be taken care of very well through audio call or a video visit, whereas before, providers may have said, oh, that would be unacceptable. So I think it's a great point.
So it was an emergency situation that propelled us into this virtual care space. What's the driving force now that everyone is accepting and very, very comfortable with virtual care?
Neil, I sort of chuckle when I say this, but I think patients are driving innovation. And of course, patients they can say what they want, but unless it's there, somebody's offering it, obviously they can't. But I think patients are basically saying, here's what we want. And so I would say that they are driving in a large measure. And, as you and I know, and all consumers know, healthcare is quite fragmented. And so part of what they're also saying is somebody's got to bring it together for me. So I want to be able to have digital solutions. I want to be able to have virtual visits, but I want the right care. I want it at the right time, and it's got to be convenient. So some numbers from our survey, 92% of consumers, 92, said that convenience is an important factor when choosing their primary care provider, and 52% citing it as a very important factor. So that's really interesting, right? So as a primary care doctor, I would like to think, people are choosing me because of, how good a doctor one is, right? But consumers are also saying, great, I want to see a smart doctor, I want to see a good doctor, but they've also got to provide convenience for me. So I think that's an amazing statistic. And right now, as you and I and all other folks know, finding an appointment these days with a primary care physician can be challenging. It can take, weeks, months, sometimes. Wait times can be long. Transportation is an issue if you have to go into the city to see your doctor, for example. Oftentimes you have to take time off from work. Each of those is a barrier to getting the care that you need. And patients are basically saying, we don't want barriers anymore. We want to be able to get the care that we want, that we need, when we want it in a convenient way. And it shouldn't always have to mean me, the patient, going in to see you at the doctor. The other point that I might make here is that there are companies out there that are creating what I might call point solutions. So, for example, we have a solution for male pattern baldness. Well, that's great, and that might work. But, nobody really wants to have their healthcare be a string of point solutions. So the other thing that the survey pointed out is that people are looking for holistic care. They want somebody to understand who they are holistically and help them take care of their health, understand their health needs, and they want a provider who can integrate all of, if it's a point solution, fine, integrate things together so the patient doesn't have to do that. So some numbers from our survey, the Healthcare Insights study, 81% of consumers said it was important for their primary care provider to be aware of their overall happiness. And a full percentage said that it was important for the PCP to be aware of their stress and their health goals. So this is people saying, we want not just to be known for what do I need for my male pattern baldness, but who am I? What are my health goals? What are the things that I am happy about, that I'm stressed about, and how can you as a provider help me, achieve wellness? And then I guess the last part I would say on this question is the consumers are asking for coordination. So 85% of consumers said it was important that their PCP be aware of their prescription drugs and also care provided by other physicians. So this gets to this integration, how important it is that the healthcare these days needs to be integrated so that a PCP, a primary care physician, can take the best possible holistic care of a patient, and that's what patients are asking.
So it seems that consumers are very comfortable with virtual care now. They seem to have deeper conversations with their healthcare provider virtually as opposed to, face-to-face in the office. You were talking about some barriers. And convenience. Convenience seems to be the key. We want what we want when we want it, and we want it correctly.
Yeah, I think that's exactly right. If a patient's got something that's complex and they feel like I need to look the doctor in the eye, or I know that I need to be examined, there's obviously a place for face-to-face care. There's a place for specialized health care that requires driving into, a medical center. But there, more often than not, healthcare issues can be dealt with by video visit, by telemedicine. I think that's what we learned in the pandemic. And now patients are basically saying, yeah, this works very well for most of my healthcare needs. And I want to be able to have it when it's appropriate. And I also want to be able to have a relationship with a primary care doctor who I can go see when I need to. So we need a continuum of care options, and that's what patients are asking for.
Dr. Fairchild, it's been a pleasure speaking with you this morning. I know that a few minutes that we have is not adequate to talk about such a broad topic, but hopefully you'll make some time to come back and join us again.
Yeah, thanks so much. It was a pleasure speaking with you.
You as well. For more information, type CVS Healthcare Insight Study in the search bar for this year's findings. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. David Fairchild, Chief Medical Officer at CVS MinuteClinic. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.